one of the key scientific tools is called functional MRI imaging. So some of you have had MRI scans of your back or your neck, and that shows the structures, right? Functional imaging actually shows the blood flow, and typically it's done to the brain. So what we know is that people with acute pain, people who sprain their ankle or bump their elbow, if you put them in one of these scanners for the functional MRI, a certain part of their brain lights up, and it's where you'd expect it to be, the somatosensory cortex, where sensations are experienced in the brain. So it makes sense. But if you scan someone whose pain doesn't go away after a few days or after a few weeks, but in fact it lasts months and months, so it's called chronic pain, lasts more than 3 to 6 months, it has a new definition. A scan of that person's brain doesn't show increased blood flow in the somatosensory cortex anymore. It shows it in the amygdala and the prefrontal cortex. Well, what do these mean? What do these Greek terms mean? It means it's a different part of the brain. It means that chronic pain is different than acute pain. And it means that those parts of the brain are more closely linked to the emotional centers, like the limbus and the hypothalamic areas of the brain. So we have scientific corroboration for something that Sarno observed 40 years ago. And now we have the science behind it saying acute pain is not the same as chronic pain, although too many doctors treat it the same way. And we understand the process by which chronification occurs, by which pain kind of gets stuck in the nervous system or gets stuck in the brain.
Thanks for tuning in to the Elevation Recovery Podcast, your hub for addiction recovery strategies, hosted by Chris Scott and Matt Finch.
Welcome to episode 202. My name's Matt Finch, and joining us today is a very special guest, Dr. David Schechter, MD, who graduated from Princeton University with a degree in biochemistry and subsequently attended medical school at New York University, and he fortuitously met rehabilitation professor Dr. John E. Sarno while seeking relief from a nagging knee problem. He achieved a rapid recovery after learning about tension myositis syndrome, TMS, a diagnosis that emphasizes the role of emotional tension in causing and perpetuating many painful ailments. Dr. Schechter was also my doctor for chronic pain. He spent a lot of time with me in his office, and I could tell that he really cares for his patients, which was a breath of fresh air given my experiences with previous doctors. Toward the end of our consult, he diagnosed me as having TMS and said there was nothing wrong with my shoulder or neck. After that, Dr. Schechter drew me a really helpful visual aid, which explained how I had literally wired my brain for chronic pain. Dr. Schechter also informed me that I had a tension-generating personality, which came as no surprise to me. He said I was creating tension daily by putting such incredible demands upon myself and not giving myself enough time to relax, have fun, and really enjoy life. I was basically just achieving goals all the time, and I was never satisfied. Dr. Schechter explained how these and other personality traits were leading to my tension, which were at the core of my TMS pain. In the visual aid he drew for me, it showed how to diminish the strong wiring of the pain over time by thinking psychologically instead of thinking about my neck or shoulder pain and obsessing about it and being hyper-vigilant about trying to fix it. Dr. Schechter informed me that it would take some time for the strong wiring of the pain to fade away, but that as long as I made this new way of thinking psychologically powerfully wired by repetition over time, my brain could destroy old neural pathways and create new ones. And to make a long story short, I've been chronic pain-free for many years now, and it's all thanks to finding this unique healing modality for chronic pain. And I feel so lucky that I was introduced to this information, hired Dr. Schechter to be my doctor, and then worked with one of his recommended therapists, Daniel G. Lyman. It feels so good to be totally out of chronic pain, and now my mission is to help others do the same. So without further ado, let me now present you with our very special guest, Dr. David Schechter. All right, so thank you so much, Dr. Schechter, for round 2. Pleasure to have you today.
Glad to be here.
And on not too long ago, I interviewed Daniel G. Lyman, who was my pain therapist, who you recommended when I went and saw you and helped me with the chronic pain treatment plan to get rid of my pain. I'm happy to say that nowadays, no shoulder pain or tension, no neck pain or tension, no anxiety, no any crazy stuff. And it's because I found Think Away Your Pain by Dr. David Schechter. And I started to do this path of healing that a lot of people thinks that it's like not evidence-based, it's total hogwash. It was natural for me because I grew up in a holistic herb school of my parents. So we'll start with this quote by Gabor Mate, MD. When the body says no, that's the book that this is from. He says there's lots of research on mind-body healing. It's published in bona fide and major medical journals, but it disappears without trace. It's like it has no impact on practice. It's despite all capital letters, despite the evidence, not for the lack of it, that we practice the way we do. And then a quick quote from John Sarno, MD, from Healing Back Pain. I believe that all medical studies are flawed if they don't consider the emotional factor. So we'll just open it up with that. I mean, you're the type of doctor that are like these doctors, and you trained under Dr. Sarno, but modern medicine in the United States, at least, they don't look at emotions and repressed emotions and psychology, and they probably don't even look too much at the patient's lifestyle and environment. It's very, what's the underlying cause? Do we need to cut this thing open in the back, or do we need to put this thing back into place? I mean, so why is it so just messed up in the United States? Meanwhile, you've got, in the end of this book, there's dozens and dozens and dozens of testimonials of people that went to see you after years or decades of not healing. These will make people believers right here, just reading those testimonials. I can't wait till you do a revised edition so my testimonial can go in there, because I've got a profound one. So I just open it up to that.
Well, those are two great quotes. Medicine in the U.S. and much of the Western world seems too cut and dried. You come in, they don't spend much time with you. They make something resembling a diagnosis and they prescribe a pill. Now, that's oversimplified, but unfortunately, that's a lot of what goes on. And even in the chronic pain area that I specialize in, I've had patients who've seen 20 or 30 physicians, alternative practitioners, chiropractors, naturopaths, acupuncturists, and nobody has asked them the key question: what is going on in your life? What are you upset about? What are you angry about? How are things going with your spouse, your job, your finances? Nobody has asked them what their childhood was like. And there's tons of scientific evidence that your childhood is a key element of your health as an adult. We could have a separate conversation on adverse childhood experiences, or ACEs, and how they contribute to your health later on. But the point is that these questions aren't being asked. And so one of the reasons I have success in treating chronic pain and related disorders is that I ask these questions. I want to understand the patient, not just the biochemistry of the so-called disease. And there's a lot of oversimplification that goes on in medicine, and it takes a little bit more time, but it's clearly worth it if I'm getting these great results that I've published in research studies and that you attest to in your own testimonial as well as others.
And, I could probably quote so many different parts of this book now. This is just, I keep coming back to this. And one of the passages in Think Away Your Pain that you wrote is, this is not a way for doctors or practitioners in general, typically, to get rich, to make a lot of money. It's very time consuming dealing with the emotions and getting to know the patient and their situation. And like you said, all the way back to their childhood. That sounds, to a lot of doctors, I'm sure that sounds time consuming, unnecessary, messy, non-evidence based, and not a lot of money into it. I mean, it's the same thing with addiction, doing addiction the way I do it with coaching people. I mean, to make money in this field, open a long-term residential treatment, bill the shit out of the insurance and stuff. So a lot of good things.
You pointed out 4 or 5 important points. The only one that I would really counter quickly is just to say that it is evidence-based, in that we have so much science now about chronic pain and what it really means and the psychological impact on your health. We have lots and lots and lots of studies. So that's one thing that doctors aren't totally aware of. It does take a little bit more time. And so a healthcare system that reimburses doctors for these kind of quick in and out visits is not a great system to explore these issues. That's a problem. It is a little bit less lucrative. Now, again, I have a car, I have a house. What do I need? I have to have a Rolls Royce. I'm not that kind of a person, but there are physicians certainly who are paid better to do procedures and surgery and that kind of thing. Medical school is expensive, and obviously it's a long training process. The other thing is that people tend to do what they're trained in. So I've spoken to doctors at facilities like California's Kaiser Permanente, where they aren't paid to do procedures, they're on salary. So it shouldn't really make a difference whether they teach TMS, MindBody, or whether they do an injection. But when I've spoken to pain doctors there, they say to me, well, this is just the way I was trained, so that's what I do. So it's kind of like a rote thing. They kind of just do what they've been trained in, and they're not really necessarily open to scientifically based, but innovative or alternative approaches in many cases. So that's a problem as well. And the other thing you said is it's kind of messy, and human beings are messy, right? I mean, life is messy. I mean, you work in that recovery addiction field. It's a messy field, and people who are selected for medicine in this era, they still are focusing a lot on your science GPA, which is important, but it's not the whole thing. And they're focusing a lot on your ability to be a good student, but not necessarily to be a good conversationalist. But what's really important in medicine, like having a conversation with your patient, having a dialogue, communicating, getting to know people. And so that messiness is probably a factor in all of this as well that you point out. So you're making a number of good points as to why this field hasn't grown as we would like it to be growing, but it is growing. There's a lot more psychotherapists and psychologists doing this work than there were 10 or 20 years ago. There are more physicians, both in the US and in other countries, that I'm aware of that have kind of become my colleagues in this struggle. One of them was on Good Morning America this morning. So that's kind of exciting. I haven't seen the episode yet. Hopefully he did a good job, but that's a pretty big TV show to be on. And publicity of all types is important, social media, regular media, podcasts. It all contributes to people hearing this message. There are a couple of apps out in the last few years. One of them I was kind of an advisor to in a distant way. And these apps have helped reach a new audience of people who are learning about the mind-body connection and the importance in their health. So little by little, we've progressed a lot since the days when Dr. Sarno and I used to say if we could have a national conference on this condition in a closet. And there would be room for the clothes. There'd maybe be 3 or 4 people in the clothing, and we'd have room for it. So things have changed in that regard, but we still need to grow the field further.
Wow. Yeah. And then you're talking about decades and decades ago, just in the span of from when I found TMS and Dr. Sarno, and then you and many other authors and people. Already there's way more books out. There's way more podcasts. It seems like even mainstream articles, I won't look into that, but there was one that I read this morning in preparing from this. I forget the website, but it was like an eating disorder, an eating psychology blog. And the title was something along the lines of dealing with health anxiety. And it was talking about these different types of health anxiety and these different types of tension, the muscle tension and everything. Mentioned you in there and a few other TMS doctors. So, and what I love about seeing all this stuff is a lot of people are writing about it and speaking about it in a way that is more, can be enter the mainstream more. To me, frankly, it makes more sense. How the nervous system and how the brain, yes, the repressed emotions and anger, and that's the messy stuff right there, right?
Yeah.
So for me, I like that since it was so messy before, at least to me, I was like, wow, this is a great healing system. But it was causing me a lot of doubt because it was so Freudian. It was so, unconscious repression based. So now that it's just so much more science based and everything, you were even talking about how early childhood negative experiences, childhood trauma, can actually cause more chronic pain, more psychosomatic disorders of many kinds. I remember the first time I interviewed you too, I believe you were saying how people with low income, poor people, have way more back pain and way more psychosomatic illnesses than people that are wealthy and well off. And you also taught me at our consultation about the type T personality, and there was a alphabet soup. So you recognize all this stuff very well. You get to know your patients. You studied under Sarno. This is your deal, mind body medicine. But all the other doctors out there, if they're not taking the time to get to know their patients, then how are they even going to get the information necessary to notice these patterns of, wow, seems like all my chronic pain patients, or a large percentage of them, had early childhood trauma, or they're perfectionists, they have low self-esteem, they're do-gooders. There's like these personality traits, these demographics and psychographics that are high probability for the chronification of pain, which I would love if you talk about that chronification process. And then all these other mind-body disorders, psychosomatic, which I'm learning more and more about. And now I'm like, oh, anyone in America and many other countries should really know this stuff as an essential skill in life to be able to respond to symptoms when they come and kind of figure them out and work through them.
Well, you've said a lot. I mean, I could interview you on this subject. You're such an expert. You're really one of the most articulate experts on the subject. But one of the things you said was how we're describing this more scientifically. So let's get to that for a second. Dr. Sarno, the pioneer in this field, who I had the opportunity to work with as a medical student. In fact, he helped me get rid of my knee pain that I was having at that time, which was a psycho-physiologic disorder. And he wrote his books, as you say, in a very Freudian way. So he was a kind of a scientist of observation. He observed and noticed things and formulated theories and wrote books and helped a lot of people with that. But what's happened over the last 20 years, as Dr. Sarno's career receded and eventually he retired and passed away a few years ago, is that the younger physicians who followed in his footsteps, including myself and others, have begun to articulate these messages in a more scientific or brain-oriented or neural pathway-oriented model, which, as you say, is probably easier for people to digest and accept in the 21st century. And although psychology underpins it, we really have scientific bases for a lot of these things. Now, one of the key scientific tools is called functional MRI imaging. So some of you have had MRI scans of your back or your neck, and that shows the structures, right? Functional imaging actually shows the blood flow, and typically it's done to the brain. So what we know is that people with acute pain, people who sprain their ankle or bump their elbow, if you put them in one of these scanners for the functional MRI, a certain part of their brain lights up, and it's where you'd expect it to be, the somatosensory cortex, where sensations are experienced in the brain. So it makes sense. But if you scan someone whose pain doesn't go away after a few days or after a few weeks, but in fact it lasts months and months, so it's called chronic pain, lasts more than 3 to 6 months, it has a new definition. A scan of that person's brain doesn't show increased blood flow in the somatosensory cortex anymore. It shows it in the amygdala and the prefrontal cortex. Well, what do these mean? What do these Greek terms mean? It means it's a different part of the brain. It means that chronic pain is different than acute pain. And it means that those parts of the brain are more closely linked to the emotional centers, like the limbus and the hypothalamic areas of the brain. So we have scientific corroboration for something that Sarno observed 40 years ago. And now we have the science behind it saying acute pain is not the same as chronic pain, although too many doctors treat it the same way. And we understand the process by which chronification occurs, by which pain kind of gets stuck in the nervous system or gets stuck in the brain. So that's an important part of the science. It addresses that chronification that you mentioned. And it's a good way to communicate to my patients about what's happening inside their body in a way that they can understand, but at the same time, it's more contemporary and scientifically based.
That is very scientifically based. And Daniel even had told me about a new study that I believe is finished, and then it's going to be published soon, where I think they accurately predicted who would get chronic pain. I think it was either a double-blind study or a triple-blind study, and they did these brain scans and did testing and everything. They could predict whose pain would turn into chronic pain by that. That's just insane stuff. And so a lot of people have already reached out from that last session that was titled, Everything You Think You Know About Chronic Pain is Wrong. And people were like, oh, I for the first time ever, I feel like I finally have some insight into my fibromyalgia. or my chronic fatigue syndrome, or my low back pain that keeps coming back. And it's just really exciting for me because even though this is an addiction recovery podcast, this is relevant for everyone. And so many of the people are on pain medicines or off pain medicines and trying other things for pain. I wonder if I can turn right to it. Here we go. From page 39 of your book. Look at this. Here we go. Unfortunately, during an acute attack, some people allow their minds to run wild on hunches, fears, and bad information. Sometimes patients assume the worst, and in the process of worrying about pain, they actually make it worse. Many health professionals make the problem more severe when they tell their patients who are suffering a routine acute attack of all the things that could be wrong. This only intensifies fear and causes patients to seek all sorts of solutions. My favorite part, that literally run from A to Z, such as acupuncture, Botox injections, chiropractic, deep tissue massage, electrical stimulation, facet blocks, growth hormone, herbs and hypnosis, injections, joint mobilization, K-laser, ligament injections, magnets, medications and meditation, narcotics, osteopathy, physical therapy, qigong, Reiki healing or rolfing, surgery, TENS units and other electrical nerve stimulation, ultrasound treatments, VAX-D, water therapy, and yoga. I am still trying to find the back pain solution that starts with a Z. So it's been some time. Have you found one yet? By the way,
No.
I tried half of those for my shoulder and or neck pain. None of them had lasting success. Why? Well, I guess none of them dealt with my emotions, did they, Dr. Schechter?
No, they really didn't. And anytime a condition has so many different treatments for it, you really have to wonder, like, why is that? It's because none of them are really that effective for most people. And because some of them will just have a placebo effect, a change in your belief or fear, and they may work on that basis. So some are placebo, some work for some people. I mean, if you have tension in your muscles and you get a good massage, it might relieve it, and that you might not need anything else. If you could get a massage every day, you probably lower your stress in your body quite a bit. People who have the money to get a massage every day don't have the time. People who have the time typically don't have the money. But obviously, these things don't fix it. So that's why there's an A to Z, and that's why there's a need to approach these problems in a different way, which obviously we're talking about today, which is looking at the connection between the mind, the brain, the emotions, and the symptoms that you're having. Early on in the show, you mentioned that it's not just pain. So people can have certainly all the pains you've mentioned, plus headaches and migraines and things like that, but it can also be palpitations. It can be kind of extra skipped heartbeats that are presuming you have a normal, healthy heart and got that tested out. That can also be a stress reaction. That's not pain. Sometimes nausea can happen as a result of stress, and that's not pain. There's people who have, unfortunately, a horrible condition called cyclic vomiting, where they vomit unnecessarily and excessively. And again, that's not pain, although it may be painful to do it repeatedly. It's another stress-related condition. Insomnia is not pain, but that clearly has a stress-related role, the inability to sleep. So there's a ton of areas where the mind-body method and the mind-body approach can impact. Chronic pain is one of the strongest, and then some of these other things I mentioned are also psychophysiologically based, connected between the emotions and the body.
Well, and it seems that due to the chronic pain and so many other PPDs going way up, seemingly that's directly proportional to our overall stress going up. Seems like the more stressed out and financially unstable the country is, the more rates of addiction and chronic pain and tension headaches, migraine headaches is going up. And so I want to talk now about some of your stages of healing. So before we even started recording, you were telling me that you actually have a plan to help bring this stuff into the mainstream, bring it into schools. Your treatment with me was perfect. After all those treatments, A to Z either failed or they'd give me a placebo cure for a week or two. Then, the pain would come back somewhere else. And I'd have those deep tissue massages once a week for a while. But at 1 or 2 days after I had the massage, the tension would just start, but I could feel it building from like a day after. So if there's still the unresolved stress in your life, the unresolved childhood trauma, if there's all these unresolved things, no matter what treatments you get that are physical, it's just going to keep going from one to the other. Even if you get a powerful surgery that works as a great placebo to get rid of something else, probably a day or a week or a month later or an hour later, something else will come up somewhere else. So you've got a great stages of healing process. You've got, seems like you have a kind of cool strategy of how we can get this stuff into the mainstream more.
Well, you need a strategy to defeat a difficult problem and to deal with this challenge. But you're giving me an opportunity to speak to two things. So one is for decades, I've been treating people in their 20s, 30s, 40s, 50s, 60s, 70s, and beyond for chronic pain. A treatment is obviously one thing you can do as a doctor, but wouldn't it be great if we could prevent some of this, right? Like we're getting a vaccine now to immunize us to prevent different diseases, COVID, et cetera. So how do you do that? The only thing I could think of was really we have to get this into the schools. We have to get this to younger people. And to learn this, it's a little bit abstract. So I didn't want to teach it to 7-year-old kids. I want to teach it to teenagers, to adolescents, people in middle school and high school. They typically have a health education course that they take once in high school and often once in middle school. Sometimes it's 6 months, sometimes it's a year. And they learn about nutrition and the body and sexuality and a bunch of different stuff. What they don't often learn enough about is stress and how it affects their health. So I've written a curriculum that could last anywhere from 1 to 2 weeks that includes a MindBody workbook for teenagers, as well as a series of PowerPoints, a teacher's manual, and obviously, guidance to the teachers who are using this curriculum. And I'm talking to different schools about piloting the program. One school has tried it already. Another one seems to be on the way. So the idea would be pilot the program, get it improved, and then try to get it to as many school districts as possible. I'm looking at this as a nonprofit element of my career. And so I'm not charging schools for this. If we end up charging fees later on, it'll just be to be able to hire an assistant to help, distribute this and all that. But this is not a profit center. This is to really try to prevent these conditions in the future, get them early, get those young people and teach them how to journal, teach them how to expressively write, teach them how to be aware that their emotions and their stress and their social life and other things that go on in teenage years, can lead to a lot of bad outcomes, vaping, addiction, depression, et cetera, as well as chronic pain. And let's get it early. Let's explain it. Let's give them the opportunity to voice some of these concerns, stop stuffing the emotions inside. So I'm really excited about the idea of getting this to younger people to prevent, not just treat the epidemic that you talk about with the stress in our society. We've got teenagers who are stressed about getting into school. We've got teenagers stressed about getting out of school, trying to get into the best college. And obviously, just being an adolescent, you're worried about your social life. Does she like me? Does he like me? Am I in the right clique, the right group? Do I have friends? Do I not have friends? And it's a tough time in life. So if we can really help the teenagers to learn this when they need it and when they're old enough to understand it, then I think we can impact the future. So that's my goal now that I'm working on.
Well, if there's any way at all that I could help you, other than interviewing on podcasts, let me know. Prevention, I love it. They've tried prevention with drug prevention, and I'm sure it's had some success. I was a miserable failure of the DARE program when I attended, I believe, in 1989 with Officer Saffles, a female cop. It was really, I even remember the song. But now they're coming out with a opioid vaccine, the National Institute of Health Helping to End Addiction Long-Term Initiative. So yeah, they're going to be able to prevent, fentanyl and other opioid overdose or even the high from it. And so what you're talking about is not a vaccine for chronic pain, but getting teenagers when their brain, they're still such in learning mode right then. They're in school and they're teenagers. They're just learning. What a great time to arm them with emotional journaling, stress management, self-care, when I did your MindBody workbook, so my path of healing from this shit was so crazy the first few years, but at that point, my pain was gone from my massage therapist doing rolfing. But then neck pain came maybe 5 days later, chronic neck pain, which was a lot better because I could surf and lift weights and everything. With the shoulder, I was debilitated. And then so I found your MindBody workbook. It was before, I didn't even know about your book then. I got the workbook. Dr. Schechter, I think I wrote in that for maybe 10 days before my neck pain was gone. And then up until the journal was done, I did it for a whole month, I believe. Neck pain was gone. I stopped journaling. A week later, shoulder pain came back. And then, it was probably still over a year, more than a year, maybe even 2 years before I was pain free. So my goal nowadays is to help people kind of speed up the time it takes from when they get this awesome information, these books, and how fast they can heal. It's the same thing what we're doing with this podcast for addiction. Like, here's the kind of some accelerated steps you can take once you know what your issue is and you've got the right diagnosis. Now you can have some strategies.
Well, you mentioned addiction, and you also mentioned that a lot of people do get into addiction problems because of pain medications, prescription pain medications, opioids and stuff. So I think there's a close relationship between some of the work I do with chronic pain and the addiction stuff. And I have consulted with a couple of addiction centers where they wanted me to work with the people who they've gotten detoxed now, but they were addicted to painkillers because they had a pain problem. So how are they going to go back out in the world? And what are they going to do for their pain problem? Now, it turns out a lot of those pain problems actually were this condition we call TMS, this mind-body condition, rather than a structural problem for their pain. And so if I could work with them on TMS while they were working on their recovery from addiction and sobriety, you could kind of kill two birds with one stone, and you could reduce the chance that they would relapse. So there's a lot of connection between the addiction side of your work and the mind-body side and the chronic pain side as well.
Yeah, I would say a close estimate, probably out of the clients that I've worked with over the years, maybe around 60% of them got onto opioids in the first place, doctor prescribed for pain, and then it's just a huge percentage. And also, we're also talking about emotional pain. So a lot of people get put on opioids for physical pain, but myself, the reason that I was loving drugs was not because of chronic pain back then. It was emotional pain. It was deep feelings of low self-esteem and insecurity, unworthiness, a lot of crazy stuff in my childhood that probably shaped my brain really negatively. A lot of stuff, even as a young adult, was happening. A lot of it was my choices getting into bad situations. But so I would numb emotional pain, mental pain, physical pain. I wouldn't, anything that if I didn't feel comfortable, I wanted to use substances. In high school, they didn't teach me how to journal. They didn't teach me stress management. I memorized history facts and mathematics equations and how to do them, and science, which were all great things, but they're ultimately not very effective in life if you're not able to kind of regulate your emotions and your behaviors. I was very unregulated. I just, pleasure, run away from pain, run towards pleasure. It was for living for the day, and long-term consequences, I didn't even think about them.
Well, that's a summary, unfortunately, of how a lot of people get into addiction problems. And what I've been discussing is, being more cognizant of the social and emotional learning. I mean, it's important to learn history and math, but you need to learn life skills. And some people get it from their parents and some people don't. And the schools are a logical place to learn some life skills that can really help you deal with or prevent problems in the future. And then even if you just kind of in the back of your mind learn some of these life skills, maybe you're 24, 25, have a job that's kind of stressing you out and you get headaches, and you go, hey, didn't I learn about that in high school? I mean, it's like headaches and stress. And so maybe that can alleviate it. Or if a doctor attempts to prescribe you opioids for a low back problem, you can sort of discuss with them more coherently, doesn't that a risk of addiction? And aren't there other ways to deal with back pain that might have some more to do with my mind and body connection and stuff like that? So I'm hoping that the teenagers who eventually graduate from this program that I'm putting together and that I'm trying to get into schools will sort of be able to advocate for themselves, even in doctors' offices, because we're probably not going to be able to train every physician to be as aware of this as they should be. So we'll start by training the patients, in a sense, when they're in school, And then when they go out and become adults in the world, they'll have a little more knowledge of this stuff.
I love it. Well, I think your plan is going to work 100%. It's going to take some time, but that's like a foolproof plan, because then a lot of those students, some of them are going to get interested in not just using those techniques for their own life, but also becoming a professional, whether it's a doctor that uses the mind-body approach or a therapist. So it's really exciting to get that out to them. And while you were saying all that too, I just had a quick epiphany of why it took me so many years at the beginning when I was wrestling with this stuff. And you wrote about it in your book, and I'm not sure I've seen other people write about it in their books on this. I was convinced at many phases that I did have structural stuff. It was maybe 10% or 50% structural, and then certain emotional stuff. That's really what was so hard for me. And you even wrote in your book, I almost didn't want to put this in my book because then it gives that extra doubt. But I'm really glad you did, because no one else was talking about it. I didn't see it at all in Sarno's books. It was like, it's 100% this emotional stuff. And I was like, well, but I really did injure it. And, it really does feel like there is some structural stuff.
Yeah, so you're referring to the concept of a mixed picture.
Yeah.
So there's some people I diagnose and treat purely on a physical or structural or biochemical level, because that's what I think is the correct way to go. And there's many people I treat purely with the mind-body strategies that we have started to talk about, the journaling, the reading, the education, group classes, therapy, etc. But there's a group of people that have something structural, but on top of that, they're amplifying it with the emotions, or they're catastrophizing it with the emotions. And so there's a mixed picture. But the thing to work on is the mind-body stuff, because that's the stuff that you get the biggest bang for the buck, so to speak, without anything invasive or prescription or surgery. And, if you get 80, 90% better, you have a functional life. And and you might even get 100% better, because even physical things heal once you stop overly focusing on them. So you're bringing up a good point with the mixed picture. I hesitated to talk about it because it's easier for people when it's black or white. And I think that's the way Dr. Sarno presents it, the two extremes. Either it's structural or it's mind-body TMS. But I felt it was more true to what I had seen over my career, that there's a gray area in between that connects the black and the white, so to speak, and that you should understand that, just in case that might apply to you. For you, that was reassuring to know that I wasn't just throwing out magic and saying everything's going to go away, but that you had something in your shoulder, but at the same time worrying about it made it worse, and that thinking about things differently seemed to help it overall.
I'm not sure if you can recall the first consultation I had. It was so long ago, but I was such a type T. If you looked up type T in your book, in the next one, you should put a picture of my old self. And you told me that I could, dial the knob down. I was probably a 9 out of 10 tension generating, perfectionist, do-gooder, really wanted to be successful, and a lot of that stemmed from low self-esteem and not feeling worthy. And so I have to do all this stuff. It was not chill. It was like the opposite of chill. So I've toned that down a whole lot in life. And as a result, all the pain and all the other tension stuff, for the most part, has gone away. And if something little comes up, I'm quickly able to realize, oh, it's because I'm stressed about that. And then boom, within minutes or hours, usually, maybe a day at the most, back to business as usual. So it's like so key.
That brings up the important point of, if this is about stress and personality, I can't change my personality, right? That's what people would ask me. And you're pointing out that I don't tell you to change your personality. I say to you, there's this type T personality characteristics, like which you mentioned, being hard on yourself, highly responsible, goodist, perfectionist, etc. And that you don't have to change it completely. You just have to dial it down. So if you think about those old dials on machines or microwaves or whatever, you turn it from a 9.5 to an 8.5 or a 7.5, and you get better. You don't have to turn it to a 2. You don't have to change who you are. Just dial it down a little bit and be aware of it. Be aware of how it's driving some of these symptoms And it does seem to make a big difference with just a little bit of change.
And there's also what I've noticed is different types of people regarding what they need for their healing plan. And so, my co-host of this podcast, he never needed to see a TMS doctor or therapist. He read Healing Back Pain once. And now if anything comes up, he's easily able to just boom. He's nowhere near as neurotic as I used to be. But then there's people that I was like, I am pretty much 100% sure, close to it. I needed your personal diagnosis. I needed to go to your office or some doctor that I respected and trusted that does this type of work. I needed you to tell me that this was what it is, because I was so obsessive compulsive about it. I kept going back and forth. There was so much ambiguity, and some days I was 100%. Other days I thought it was all bullshit. So I needed you, and I also needed Daniel as my therapist to have a treatment plan and a treatment team too. If there's other people like me listening, which I'm sure there are, and if they're liking what they're hearing here and they're like, wow, I want to learn more about this. What can I do? How can I get out of pain? These guys are making sense.
Yeah, the idea of a healing team is very important. I can help patients put together that team because I know all the good therapists in the country who do this work. The other thing you mentioned is the healing journey, and that your healing journey was different than your friend or colleague's healing journey. And I really focus a lot on that term now. I've been leading these groups for patients who've been diagnosed with this condition on Zoom on Tuesday evenings with a psychologist. And we really talk about the fact that, we've got 6 or 8 people in the Zoom room, and everyone's journey is a little different, right? Some people need more reassurance. Some need a real focus on accepting the diagnosis. Other people need to be told, get up and move, get some activity going here. People need different things. So because I've had, a lot of experience working in this area, I have kind of I give the guidance that I think is appropriate for the individual, and just being open to the idea that your treatment is not going to be the same as someone else. It makes sense. I mean, you're a different person than someone else, so you're going to need a different treatment. And this is not a one size fits all. We don't give a pill to everybody. We are individually tailoring the program that you need based on the tools that are available, but really trying to focus on what you need out of it.
Yeah. And for me, it was about the reason I chose to come see you was, number one, your workbook got me out of neck pain. Number two, you're only a few hour drive. I'm not sure where the next closest one. He might have been at that point. I think it was probably the Midwest, or definitely, I don't think it was in California. Yeah. And I just needed that diagnosis. And so, yeah, customized, individualized treatment. I mean, that's what we do with addiction. But when you go to the mainstream places, it is the cookie cutter, one size fits all. Here you go. You're going to do your detox, which is good. Then you're going to do AA meetings, and you're going to talk to your counselor, and you're going to go to group counseling and have education, and it's going to be total abstinence. Whether the person was addicted to alcohol or maybe even cannabis, if you're going to mainstream treatment, since you had an addiction to one thing, you have to be totally powerless for the rest of your life to all substances. That works really great for some people. It is horrible for a large percentage of people, myself included. So I'm glad that there's pain specialist doctors that are actually not doing the cookie cutter pain treatment. Okay, here's your pain management. Here's your medication. Here's for your breakthrough pain. You want to go get some Reflexol. It's just, so the way you do it, I think you spent 45 minutes in the office with me. That was after I got done filling out the paperwork. And it was like a psychotherapy type thing for the first part. And then it was more of a medical type thing. And it was a really good deal too. I'm not sure what your rates are nowadays, but that was a great deal, especially for the amount of time you spent with me.
Well, you need that much time to start to get to know somebody. I mean, I think somebody who doesn't have the experience I have would probably even need more time. But within about 45 minutes, I can take a detailed history. My assistants also help me by obtaining some of the information in advance, which helps it along. And then examine you and review your MRI scans or other tests that are there. Make the clear diagnosis, examine your tender points on your back if appropriate, which are one of the indicators for this condition. And then come up with an individualized treatment plan that begins that day. what should you do next? Are you a good candidate for just reading materials? Are you a good candidate for individual therapy or group therapy, group classes? And then I like to usually follow people up in about 3 or 4 weeks after the first visit, which can be done on video or in person now in most cases. But people are coming in to Southern California to see me from not just California, but people fly in from out of state sometimes because they want to get that hands-on diagnosis. Now that our office is open again, with the pandemic waning, it's great to be able to see people in person, which is clearly more effective than just the video visits, which are still good, but nothing replaces the being in person. Even if we might not shake hands, we still have that time together. And 45 minutes doesn't sound like a lot to some people, but in medicine, it's a lot of time. And I've had many patients say they saw the orthopedist for 8 minutes. The assistant took a history and he threw up an MRI and he said, your disc is like a jelly donut. And people leave these things horrified and almost brutalized. And they get these negative messages that their back is fragile and going to fall apart and all of this stuff. And I actually have to spend the 45 minutes undoing multiple of these 8-minute visits to kind of like deprogram the person. They're like in a cult that I have to take them out of the cult. The mind body stuff we're doing may sound more cult-like, but it's really not. It's really simple, traditional medicine combined with modern science and the input of the mind body approach. But the cult-like stuff is everything else that they're being told that they have to get spinal adjustments 3 times a week forever, or they have to take medication forever, or they have to watch out because their back is as fragile as a jelly donut, or whatever it is that these kind of fallacies that people are told. And we have to deprogram them from that. There's lots more.
You got to you helped to deprogram me, as all the texts did too, from the dogmatic pushing ideologues that are talking the dogma of, oh, your back is messed up. Well, this is because of this, just all the physical causes pain dogma. So it's great. So where can people find you? I know you've got your MindBody website. You're also a sports doctor, right? So people could even go see you for that and other things. So what are your websites? What's your email? Where can people find you? What's the next best step?
For what we've discussed today, mindbodymedicine.com is probably the best place. It has my phone number as well as a contact email system. And you can contact the office for an appointment, or you can learn more about some of the materials that I've written, and you can even link and order them through the website. I also have a website, schechtermd.com, SCHECHTERMD.com, that talks about my practice in a broader sense and also has elements of this TMS mind body as well. All of my materials are on Amazon, including the Mind Body Workbook, which I wrote in 1999, and Think Away Your Pain, and the Mind Body Workbook for Teens, which I wrote a couple of years ago, and a couple of other smaller works that I wrote that may help you. So there's a lot of material. I've got a YouTube page with some videos. I've got a Twitter account and all of that sort of stuff. So hopefully those things will be linked with Elevation Recovery Podcast, and they're also linkable on my website, mindbodymedicine.com. So I hope that you'll find this information useful, and it's always great talking to you. I really enjoy it.
Me too. I always look forward to it. It's like, and I feel like we're going to be doing this for, probably decades. You're healthy. You've got passion for this. And so, one day I'll be an old fogey. And when you retire, I promise I'll continue spreading the word about this information. I
appreciate that. We definitely need to find more doctors, therapists, and obviously teach the patients, starting with the young people and on up. There's a lot of work to be done. And I appreciate your contributing to it. And I'm still in the fight, trying to educate and communicate and treat. So that's what we have to do to make change.